Welcome everyone. I gather everyone has had time to pick up some food, so welcome everyone to the last Beckman graduate student seminar of this semester. But we will be back next semester, starting in January. Today we have three speakers today, and the first speaker will be Brendon Smith, and he received his bachelor's in applied health science from Wheaton College in 2009, and he's currently pursuing a PhD in the division of nutritional sciences, and is co-advised by Dr. O'Brien of the electrical and computer engineering department, and Dr. Erdmann from the food science and human nutrition department. And today he will be speaking about the applications and biological effects of ultrasound imaging. And the title of his talk is Applications and Biological Effects of Ultrasound Imaging.
Thanks. Good afternoon, everyone. My name is Brendon Smith, and I'm in the Bioacoustics Research Lab here in the Beckman Institute, or BRL. And in the BRL, we are all about ultrasound imaging. We study it in many different ways. I'm going to talk to you about some of those ways today. So here's a summary of my talk. I'm going to keep coming back to this throughout the talk, and by the end, you'll understand what all these things mean. But I've got 4 points I want to make today. The first one is that ultrasound imaging is sound waves applied to biological tissue to create an image. Second one is that ultrasound is flexible, functional, and fast. The next one is that ultrasound with contrast agents introduces potential for unique biological effects. And lastly, in a study we did recently, we showed that contrast ultrasound imaging of the aorta and artery alters plaque thickness and biomarkers circulating von Willebrand factor in a rat model of cardiovascular disease. So first of all, some basics. So ultrasound, by definition, is sound waves that are above the audible range of the human ear. And most of the equipment in our lab operates in the range of 140 megahertz, which is quite a bit above what the human ear can hear. And you apply ultrasound waves using something called a transducer, which I've depicted here. So the way this works is a transducer is connected by a cable here to a computer system. This computer system sends electrical pulses to the transducer. The transducer contains a special type of crystal, which is usually a quartz or a quartz-like material. A lot of the ones in our lab are lithium niobate. And this crystal actually transduces the electrical signals into sound waves. The sound waves pass into biological tissue. They're reflected back to the transducer, and then this information goes back to the computer system. The computer system interprets this, processes the signal, and generates an image. So next I was sort of thinking about what are some overarching defining characteristics of ultrasound imaging. I came up with 3, and they all start with the letter F, so they're easy for you to remember. I want to highlight 3 characteristics of ultrasound. Ultrasound is flexible, functional, and fast. I'll provide examples for each of those. So first of all, what do I mean by ultrasound is flexible? By that I basically mean it has a wide variety of uses, a huge number of things you can do with ultrasound. One of the things we do in our lab at the most fundamental cellular level is measure the dimensions and properties of cells. So, for example, we can measure the size of a cell or subcellular organelles like the nucleus. So this is a project that's ongoing in our lab. So everything from the most basic cellular imaging all the way up to human clinical imaging and research. This is an example of an application of ultrasound for human clinical research. This is imaging of the carotid artery. So the carotid artery is the artery in your neck that runs up your neck here and supplies blood to the head. So a really important artery. And one of the things you can do with an image of the carotid is assess intima media thickness. And so this is the thickness of the 2 inner layers of the blood vessel, the intima and the media. And if someone has an abnormally thick intima media thickness, that is prognostic of adverse cardiovascular events like heart attacks and strokes. And I should also mention that all you have to do to get this image is have an ultrasound transducer and apply it to your neck right here. So this is totally non-invasive and a rapid imaging, a way to image the carotid artery. So in addition to having a wide variety of uses, ultrasound is functional. What I mean by functional is that ultrasound is actually depended upon by virtually every medical specialty in real clinical situations every day. And there are lots and lots of examples. I'm just going to provide you with a couple of examples. The first is one that probably many of us are familiar with, which is imaging of the fetus during pregnancy. So you can use ultrasound to image the developing fetus and assess its growth and any abnormalities that may be occurring. And now we actually have this technology where we can create these really nice 3-dimensional images with a lot of depth and clarity, and so doctors really like this, and I think parents do also. And another use of ultrasound in medicine is in guiding medical procedures. So in this example we have here, we have the clinician is trying to inject some sort of solution into the blood vessel. What you can do is actually image the blood vessel with ultrasound. And if it's a blood vessel that's difficult to access or you can't see it superficially, you can use ultrasound to image it and actually watch as you insert this needle into the blood vessel to make sure that it's properly inserted. Same thing goes for guiding surgical procedures. So ultrasound is very useful in medicine, and I call these point of care settings. What I mean by point of care is that the ultrasound imaging can be performed on the patient, the image can be interpreted, and a decision can be made by the clinician all at the patient's bedside. And I think that also highlights the third aspect of ultrasound I wanted to talk about, which is that ultrasound is fast, meaning it rapidly delivers images. So I just provided one example here. This is a little video, and this is a video of the heart. And so I'm going to just orient you here. This is an ultrasound view of the heart. It's upside down from how you normally think of it. So sort of the bottom is here and top is here. And blood flows in through the atria, right and left, and then flows through these valves here down to the ventricles, and then the heart muscle squeezes and pumps blood out through your arteries and throughout the rest of your body. And so all we need to do is hold an ultrasound transducer on a person's chest, non-invasive, and the ultrasound transducer can create a video of the heart beating in real time. So I think that's pretty cool, especially as you watch the valves here, as the blood flows through the valves, and then the heart muscle squeezes and sends the blood out through the arteries. So ultrasound is fast, rapidly delivers images. So now that I've sort of oriented you to what ultrasound is and how it's used, I wanted to talk about ultrasound contrast agents. This is an area of interest in our lab. So these ultrasound contrast agents are micron-sized bubbles. This is an actual microscopic image from our lab here. And they either have a lipid or a protein shell. They encapsulate an inert gas, which in the case of the ones we use is octafluoropropane, if you were interested. And the purpose of these bubbles is depicted here. So these bubbles are injected intravenously, and they circulate all through your cardiovascular system. And then an ultrasound imaging is performed on a blood vessel or on the heart, some part of the cardiovascular system. The ultrasound that is being transmitted through this tissue interacts with the contrast agents in the blood vessel. And this interaction of the ultrasound with the contrast agents allows the clinician to more clearly delineate the boundary between the blood and the tissue around the blood. So basically the point of these contrast agents is they provide a better image. However, that sounds great, but some adverse biological effects have been noted after administration of these contrast agents. So in experimental models, we've seen damage to the blood vessels that have been imaged, hemorrhaging, so blood leaking out of the blood vessels, cardiac arrhythmias, so the heart is beating out of sync, and then actually in some clinical situations when these have been used, cardiopulmonary complications and actually death have been noted in a couple patients. These are clearly some concerning biological effects, and more research is needed to understand these effects. Despite these effects, these are actually FDA approved for use in imaging the heart structures. So this is obviously an important area of research and one that we are interested in our lab. So now I'm going to provide you with an example of a study that we did to assess biological effects of these contrast agents. So here's our study design. So what we did was we used a cholesterol-fed rabbit model of heart disease. So these rabbits eat cholesterol in their diets, they build up plaque in their blood vessels, and in humans, if you build up plaque in your blood vessels, that can lead to something like a heart attack or a stroke. So this rabbit is a model of plaque buildup in the blood vessels. We had 41 of these guys, and we fed them this diet for 3 weeks. At 3 weeks, we exposed them to this contrast ultrasound procedure with or without contrast agent. This is a clinically used contrast agent called Definity, and at one of 4 pressure levels of ultrasound. And these pressure levels are kind of like intensity levels of ultrasound. But the amount of Definity we gave them and these pressure levels of ultrasound are all clinically relevant. And then we carried out the study for another 3 weeks, and then we euthanized the animals, obtained their tissues, and analyzed those. And I'm just going to highlight a couple of our results from this study. One has to do with a biomarker called von Willebrand factor. And so von Willebrand factor is a protein that is produced by endothelial cells. This is the intercellular lining of your blood vessels, and so they are in contact with blood and sort of have a front row seat to what's going on in blood. And so we hypothesized that if ultrasound with contrast agents was going to affect some cell type, it would probably affect these endothelial cells. So this protein is secreted by endothelial cells. And what we saw was that after ultrasound imaging, so we have on the x-axis here, we have, this is at 21 days after consuming the diet, 1 hour before ultrasound, 1 hour after ultrasound, and then this is the next day, 24 hours. So after ultrasound imaging, the animals that received the higher pressure levels of ultrasound actually had decreased von Willebrand factor circulating in their blood compared to animals that received the lower pressure levels of ultrasound. And the contrast agent did not affect this. So this was mainly an ultrasound effect on a biomarker secreted by the vascular endothelium. Another interesting thing we noted in this study was when we just analyzed the actual thickness of the plaque in the area of the blood vessel that was imaged with ultrasound. And you can sort of see an interesting trend here where if animals did not get the contrast agent, so they just got the saline vehicle that is normally mixed in with the contrast agent, as the pressure level went up, the plaque thickness went up. However, if these animals got the contrast agent with the ultrasound, we did not see this increase. So we don't know exactly what the mechanism is at work here, but this was definitely an interesting observation, and it could indicate a couple of different things. This could be a beneficial effect whereby the contrast agents were doing something to protect against any ultrasound-induced damage to the blood vessel tissue. So that might be a good thing. Alternatively, this may be a detrimental effect because if the plaque was not as thick, the ultrasound could have done something to perturb some aspect of the plaque and maybe knock off part of it. And when that happens, actually in humans, a clot forms in the blood vessel. That clot can lodge in your heart or in your brain and cause a heart attack or a stroke. So we're not totally sure what to make of this effect. We thought this was an interesting observation from this study. So what have we learned today in the past couple minutes? Here's my summary again. We learned that ultrasound imaging is sound waves applied to biological tissue to create an image. We learned that ultrasound is flexible, functional, and fast. We learned that ultrasound with contrast agents introduces potential for unique biological effects. And then we saw in that study that I just showed you in a rabbit model of cardiovascular disease that contrast ultrasound imaging affected plaque thickness and circulating von Willebrand factor. With that, I would like to thank those that contributed to this work, acknowledge our sources of funding, and take any questions. Thank you very much.
Can you use the ultrasound to assess the thickness of the plaque as well as doing the lab work to do that?
Yes.
Both ways?
Yeah, absolutely. So one way that that's done, at least in humans, is with that carotid ultrasound imaging with the intima media thickness. That's sort of reflective of plaque deposition in the blood vessels and is considered to be reflective of systemic development of plaque, yeah.
And what's the resolution of the ultrasound? How many microns?
It can get down to, it depends on the frequency, but it can get down to, I don't know, maybe 50 microns. So it's pretty high resolution.
Is there another question from the audience? Why do you use rabbits to study ultrasound instead of mice?
So yeah, that's a good question. So we also do use mice in our lab. This rabbit model is nice because it's a very well-established model of heart disease, and also the rabbit is larger and the arteries are larger, so we can image them a little bit better. It's a little easier to see the blood vessels. Yeah, good question.
We have time for one more question from the audience. If there is one. If not, let's thank the speaker once again.